Hello, my name is Sophia Stanley, and I am a Doctor of Nursing practice student at Maryville University in St. Louis, Missouri. And this is my virtual presentation entitled Motivational Interviewing to Enhance Treatment Compliance. Throughout this presentation, I will provide insight on the issue that warranted the need for this scholarly project to take place. I will further discuss the framework outlined and implemented to introduce the significance of the study and the study's findings that can be used to guide future practice. A common issue in the outpatient mental health setting is treatment noncompliance amongst adults who suffer from mental health disorders. This issue can impose significant challenges and is often driven by a lack of motivation. A lack of motivation has been studied, and it does show that it impacts patient outcomes and also one's ability to engage and also benefit from their treatment. Lack of motivation can also worsen negative behaviors. It can lower one's morale to make positive life changes. And because they are disengaged in their treatment, they're also faced with unwanted challenges. And these challenges can range from recurrent or worsening symptoms of their mental health conditions, recurrent hospitalizations, and also an increased risk for suicide. Some research has also shown that motivation is an important element that can drive changes in behaviors and psychosocial treatment outcomes. When individuals are seeking outpatient treatment for mental health disorders, in order for them to maintain positive behaviors and be committed to therapy, they must improve their motivation and be ready to make positive changes. This brings us to the purpose and goals of implementing this DNP project. So the purpose was to assess whether a client's readiness to change questionnaire scores and therapy session no-show rates were positively impacted during their participation in treatment that used motivational interviewing by the mental health clinician. So there are benefits of motivational interviewing as well as utilizing a readiness to change questionnaire. And being able to integrate the use of motivational interviewing during treatment sessions in collaboration with having the client complete a readiness to change questionnaire are tools that can assist the mental health clinician with being able to measure a client's motivation, identify a client's negative behaviors, and assess their readiness to change. And in return, this can help support their treatment outcomes by increasing their motivation, their psychosocial functioning, their treatment engagement, and overall increasing their quality of life. The aim of this project was to integrate the use of motivational interviewing into therapy sessions in order to increase one's motivation, increase treatment compliance, and also decrease no-show rates. In regards to methods, this quality improvement initiative was presented to the university's Institutional Review Board to ensure that the safety of patients were upheld and that their rights and welfare were not being violated. After approval was obtained from the Institutional Review Board, the recruitment and data collection process began. This project was conducted in an outpatient mental health clinic in the Mid-Atlantic region of the United States on subjects between 18 to 65 years of age who were seeking treatment for mental health disorders. Flyers describing the study were placed in the waiting area of the clinic where the study was conducted. The flyer, along with a discussion regarding the readiness to change questionnaire results, and an information sheet describing motivational interviewing strategies that were used during therapy sessions, were also placed inside intake packets. The link to access the online consent and questionnaires were also placed on the flyers. A quasi-experimental design was used to assess the effectiveness of the intervention before and after implementing motivational interviewing. The sample size included 47 participants who completed an electronic informed consent and a pre-intervention readiness to change questionnaire. A percentage of no-show rates were obtained from the intake coordinator at the clinic pre-intervention. Participants were then assigned by the clinic coordinator to therapy sessions that integrated motivational interviewing used by the mental health clinician. 4 weeks following the start of treatment, the participant completed an intra-readiness to change questionnaire. So during this time, they had started treatment using motivational interviewing, and they were also currently in treatment using motivational interviewing. The intake coordinator then provided an additional set of no-show rates both during the intervention and after the intervention was completed. The pre and intra questionnaires for each participant were identified by a unique number generated when participants completed the pre-questionnaire and was used to connect the intra questionnaire to the pre-questionnaire in order to compare scores. Data collection sheets were used to organize and collect questionnaire scores, provide confirmation of participants being informed of questionnaire scores and interpretation of results, their stages of change based on questionnaire scores, treatment compliance, and also the percentages of mistreatments. The results of the pre and intra-intervention readiness to change questionnaires were compared, and the pre, intra, and post-intervention no-show rates were compared to determine the effectiveness of motivational interviewing. The data analysis was utilized to allow the researcher to interpret data and also draw conclusions. The data analysis was performed using the Statistical Package for Social Sciences program, also known as SPSS. A significance level of 0.05 was utilized as the measure to determine the statistical significance of the study. A paired t-test and z-test were used to compare pre, intra, and post-intervention data. The paired t-test was used to determine if there was a statistically significant difference and improvements with pre and intra questionnaire scores before and after the intervention using motivational interviewing. The z-test was used to determine the difference between pre, intra, and post-intervention no-show rates. So the results from the data analysis did show some improvements. The results revealed an improvement in questionnaire scores intra-intervention as compared to pre-intervention, indicating that motivation to change improved after motivational interviewing was implemented during therapy sessions by the mental health clinician. Also, results revealed an increase in stages of change from a pre-contemplation stage during pre-intervention to the action stage of change, intra-intervention. The results, however, of the no-show rates pre and intra-intervention did not show a decrease in no-show rates. But intra and post-intervention and pre and post-intervention results did reveal a decrease in no-show rates. So as you can see in this graph, This shows a frequency of data collected from the pre-questionnaire scores, with a mean pre-questionnaire score being 7.95. And a mean score of 7.95 indicates that the participant was in the pre-contemplation stage of change. And when they're in a pre-contemplation stage of change, it indicates that the participant may not be interested in changing their behaviors at the moment, or sometimes they may not be interested in completing therapy or getting some type of help. So this current graph represents the frequency of data collected from the intra-questionnaire scores, with the mean score being 11.33. And a mean score of 11.33 indicates the action stage of change. When a person is in the action stage of change, this indicates that the individual is motivated to change their behaviors and they're actively involved in taking the steps to make those changes occur. And as you may know, the previous graph pertaining to the pre-questionnaire scores and the current graph pertaining to the post-questionnaire scores were compared utilizing the paired t-test. And when comparing both the pre and intra-intervention questionnaire scores, you can see that there was an increase in the intra-intervention questionnaire scores as compared to the pre-intervention questionnaire scores. In the next 3 slides, we will discuss results obtained from comparing the pre, intra, and post-intervention no-show rates, which were compared and resulted using the z-test. In this current chart, the pre and intra-intervention no-show rates were compared and analyzed, and the results indicated that 47% of individuals did not show for treatment, while 58% of individuals did show for treatment. The results of the z-test also indicated a z-score of 0.783 and a p-value of 0.2167, which indicated that there was no significant reduction indicated in no-show rates. This current slide provides an analysis of results from comparing the intra and post-intervention no-show rates, showing that 42% of individuals did not show for treatment, with 58% who did show for treatment. The z-score that resulted from this analysis was 4.56, with a p-value of 0.000, which indicated that there was a statistical significant reduction in no-show rates. This chart represents the analysis of data analyzed from comparing the pre and post-intervention no-show rates, which shows that 42% of individuals did not show for treatment and 58% did show for treatment, with a z-score of 5.39 and a p-value of 0.000, which indicates that there was a significant reduction in no-show rates from pre-intervention to post-intervention. So just to recap on the paired t-test and z-test as previously mentioned, the first table shows the results obtained from the paired t-test that were used to compare the pre and intra-intervention questionnaire scores. The pre-intervention questionnaire scores, which were the scores completed before the participant participated in therapy sessions that implemented motivational interviewing. So pre-intervention, there was a mean score of 7.95 and a standard deviation of 1.47. Inter-intervention questionnaire scores, in which the second questionnaire was taken while the patient was participating in therapy sessions that implemented motivational interviewing. So intra-intervention, the mean score was 11.33 with a standard deviation of 0.84. And as you can see, there was an increase in the intra-questionnaire scores after the intervention using motivational interviewing was implemented. The second table shows the results of the Z-test. The Z-test is what compared the difference in no-show rates between the pre, intra, and post-interventions. So here you can see the pre and intra-intervention Z-score was a negative 0.783 with a p-value of 0.216. The intra and post-intervention no-show rates had a Z-score of a negative 4.563 and a p-value of 0.000. The pre and post-intervention Z-scores were negative 5.3904 with a p-value of 0.000. So the results of the Z-test here show a significant difference in no-show rates when comparing the intra and post and the pre and post interventions, which indicated that there was a reduction in no-show rates after the intervention was implemented. However, there was not a reduction in no-show rates pre and intra intervention. During the implementation of the project, there were some barriers encountered, including issues with participants being able to access the link provided to complete the informed consent in the questionnaires. There were also issues with linking the generated unique ID from the pre-questionnaire to the post-questionnaire, which were eventually resolved. However, due to these barriers, it could have caused individuals not being able to participate in the study. There was also missing data. During the pre-intervention phase, there were 53 participants who had completed the pre-questionnaires and also the informed consent. However, during the completion of the study, there were only 47 participants who had completed both the pre and intra-intervention questionnaires. And only those 47 participants were included in results of the final data collection. The evaluation of information gathered during the data collection period offered proof to support the conclusion of the study regarding whether or not integrating motivational interviewing into therapy sessions used by the mental health clinician will positively impact questionnaire scores and also decrease no-show rates. And based on the results obtained from the study, motivational interviewing did have a positive impact with increasing questionnaire scores and also decreasing no-show rates. The results also showed that the use of motivational interviewing also positively impacted one's motivation to make changes, as noted by increase in the stages of change from a pre-contemplation stage to the action stage after motivational interviewing was implemented. Furthermore, to promote treatment engagement and increase one's drive to change, the study emphasized how important it is to explicitly incorporate motivational interviewing into therapy sessions for people pursuing mental health treatment. This can also help clinicians help clients with mental health issues feel more motivated by connecting with them therapeutically using motivational interviewing. Also, all things considered, motivational interviewing has the potential to improve patient outcomes. And I recommend that the facility continues to utilize motivational interviewing during therapy sessions, as it has shown that motivational interviewing can increase one's motivation to change and be more compliant with treatment adherence. Also, the findings delivered from the study can help guide future studies and practice initiatives within the healthcare organizations that offer outpatient mental health treatment on strategies to promote change, be able to enhance motivation and treatment compliance, and overall improving therapeutic relationships and patient outcomes. As this brings us to the end of my virtual presentation, I would like to conclude that overall this project had favorable outcomes regarding the project's objectives to increase motivation and improve treatment engagement. I hope that you found my presentation insightful and with valuable information. I appreciate your attention and thank you for listening.